Dr. Camilleri, tell us a bit about your presentation here at the AGA Summit.
So I'm really happy to be here at the Technology Summit of the AGA, and I will be presenting information about a recent study that helps us understand that there are different subgroups of patients who have obesity. These subgroups of patients may have an abnormality of stomach function, they may have problems with psychological disturbances or behavioral disorders. So for example, we found that some patients who are obese or overweight have very rapid gastric emptying. Others have a stomach that is larger than the average in healthy people of healthy normal weight. Still others have a very significant psychological component. So they have a disturbance of body image, or they have anxiety or depression. And still others acknowledge that they don't exercise enough. So we're finding that the intervention to help these people lose weight may need to be tailored or individualized to the particular problem with which they come to see us as physicians. So what are the opportunities for patients and doctors to help them to lose weight? Well, there are medications, for instance, that can help to restore normal stomach function. So instead of food emptying from the stomach too fast, food can be retained in the stomach a little longer so people can feel full after they eat a meal. And similarly, if a patient has a stomach which is larger, there are either medications or devices such as balloons or types of surgeries that can reduce the size of the stomach. In other words, we are moving in a direction that would individualize or personalize the treatment of obesity, depending upon what is the problem that can be identified with relatively simple tests. Now, this provides an opportunity for gastroenterologists to be very much more involved in the management of patients with obesity. We have an obesity task force in the AGA, which is striving to develop methods for team-based management of obesity. But we also have opportunities related to medications that have recently been approved by the FDA and which we believe gastroenterologists could prescribe for their patients. And finally, there are procedures, endoscopy-based procedures, that should become available for the relief of the problem of obesity.